Hello, my name is Catherine Hodge. I'm an In His Image graduate from 2013. My family moved to Nkhoma, Malawi in the year 2014, just after we graduated. We've been here at Nkhoma Mission Hospital for about 6 years now, and in the time of coronavirus, we've had to make some recent changes. So this is our hospital entrance. If you look this way, we had to make some changes to the entryway so that we could do some proper triage and screening. So we put some lines on the ground, and in the busy times of the day, which is 7 a.m. to 4 p.m., we actually triage about 1,200 people, because that's when all of our sick patients will come in and all their family members. So the patients will wash their hands at the washing station here at the front, and then they'll stay a little bit distanced on the lines while our team, wearing their full PPE, will then ask them about travel history, recent fever, cough, shortness of breath, and then from there, our clinician will do a respiratory triage system where we decide if a patient is a coronavirus suspect or can just go through our regular outpatient department.
I'm Dr. Christina Miller. I'm a specialist in family medicine and preventive medicine with the Christian Health Service Corps, and I've been working with Catherine on Nkhoma Mission Hospital's Disaster Preparedness Committee. We work with a team of representatives from each department as well as management to try to prepare Nkhoma Hospital for coronavirus. 4 weeks ago, there were only 40 cases of coronavirus in the country, and now there are over 450. So we're really seeing increase after increase, week by week, of coronavirus. We've put a lot of things in place, not only just the triage, but also things like decongesting the hospital, getting patients in and out of the hospital quickly, making sure that there aren't too many visitors passing by, even making sure that there are 17 new hand washing stations throughout the hospital. So we did have our first positive case here at Nkhoma Mission Hospital just last week, and it was a woman who was pregnant and a woman who was critically ill needing oxygen. But we were able to take her to the isolation ward. We were able to have complete protective equipment because in part donations from our partners, and we were able to take care of her in the time it took for the test to be taken and the test to return positive. And then the district health officer came and picked her up and took her to the treatment center in Malawi. So it was really a nice, smooth process where we were able to work hand in hand with the local government authorities. And then that district health officer and district environmental health officer worked with our Nkhoma environmental health officers to go into the community and trace contacts in that case. So we continue screening. We're screening over 10,000 people every month who are coming through the doors of Nkhoma Hospital, making sure that they don't have fevers, or if they do, that they have proper masks that they're wearing or that they're separated and isolated. So we've gotten some donations of oxygen machines that will be able to fill a male side and a female side up to 16 patients at a time that might need oxygen as they're waiting to either go to government treatment facilities or go to the normal ward if they're negative. So as of now, Nkhoma Mission Hospital is still not a coronavirus treatment facility, but we do stabilize patients as we're waiting for their test results to come back, which can take a couple days at a time. And we saw that that was life-saving for the first patient that we had. We've tested several other suspect cases, which have fortunately been negative, and we've been able to take care of them in a regular way. So we'd like to thank all of our partners for giving donations in kind and donations of money for PPE and for oxygen supplies, and we'd like to thank our management for helping us prepare this disaster preparedness plan well in advance so that we were ready when as the cases are coming and as the cases are escalating.
Coming out there into our districts, but not very well understood yet how exactly the community and the central hospitals at large are going to respond, because as you know, there's worldwide shortages of everything, including test kits. So our ability to test as a country has been very limited, as it has been many places. So we're preparing for many of these cases to come our way, but we're doing our best to keep coronavirus out of the hospital right now so that we can be taking care of our regular patients who still have all the same needs that they would on a normal day. And we're trying to keep our staff spiritually motivated and physically motivated by giving them the right protective equipment and by keeping the virus out of our hospital for as long as possible so we can continue to treat our other patients.